Hi, I am Dr. Rajshekhar C Jaka, consultant surgical oncologist and robotic surgeon, Manipal Hospital Whitefield. Let me tell you something about a very important topic of cancer of ovary, because it has become so common and unfortunately many women come in little later stages. Majority of the women we see in a stage 3. So I am really concerned about this. First, do we know why does this happen? No, we don't have a definite answer. When we don't know why does it happen, so we should detect it very early. That is the only way to cure it and get rid of it. Bloating, a distension of abdomen or gastritis-like feeling. Unfortunately, there is no specific sign of a cancer. Here, they always feel there is something is abnormal in the tummy, there is a gas trouble, there is a gastritis. These are such a non-specific things which, if it is investigated, we will find out that there is a cancer. So it is very important for a woman more than 40 years of age, if at all she continues to have very often abdomen bloating or gastritis like symptoms, a simple ultrasound of the abdomen will tell us, will clinch the diagnosis that there is something serious. So unfortunately, majority of the women come in stage 3 because when there is a water accumulation, abdomen gets distended because they don't feel it in the earlier stage, and when there is a breathlessness, these are all the later symptoms. So earlier symptom is only the bloating or gastritis like feeling or mild discomfort in the tummy. This is very important to be recognized. We know there are two ovaries on either side of a uterus. They get enlarged in a tumor, and don't worry, always enlargement of a uterus doesn't mean that there is a cancer. It can be a simple cyst which is a non-cancerous thing, or sometimes these cysts, when they get enlarged, there can be a solid component into that, or it can be a complex cyst, or there will be increased vascularity, or there is a solid component of a full tumor, or there is an accumulation of fluid in the tummy. All these indicate that there is a cancerous component. Initially, we do ultrasound of the abdomen, which is the simple basic investigation, and if there is any doubt that yes, there looks like some suspicion, then we should go for a contrast enhanced CT scan or a PET CT scan. PET CT scan usually we do when we are sure that there is a cancer of the ovary, and to assess the extent of spread we do it. One more thing is CA-125. It is a blood test which is a tumor marker which is related to carcinoma of the ovary. Most of the times it gets elevated in cancer of the ovary. The third thing is we need to prove by cytology that it is a cancer. If at all we are considering any neoadjuvant chemotherapy, that is a chemotherapy given prior to surgery, in that case we remove some amount of fluid from the tummy and send it for examination. But mind you, we should never do a biopsy from the ovarian tumor itself if at all it has not spread in the abdomen. It is very important. If there is a spread in the tummy, most often the biopsy is done from either omentum or peritoneum, other parts other than the direct ovary per se, because if a biopsy or a puncture is done in the ovarian tumor itself, then it may rupture and it may spread into the tummy and it may spread all over the tummy. That is why it should be carefully done, and if at all we are considering surgery first, there is no need of doing this.